Number 1. Flipped LDH indicating myocardial infarction is represented by LDH1 greater than LDH2, LDH2 greater than LDH1, LDH4 greater than LDH5, LDH5 greater than LDH4. And the correct answer is A. LDH1 greater than LDH2. And here is the hints. When LDH1 is greater than LDH2, it is referred to as flipped LDH and is indicative of MI. LDH1 isoenzyme is found primarily in heart muscles and is lesser in concentration than the LDH2 isoenzyme, which is primarily found in RBC. When the concentration of LDH1 is observed to be greater than the LDH2, it is referred to as flipped LDH and is indicative of myocardial infarction. Number 2. All of the following are selective indications for the use of hypertonic solution except dehydration secondary to diuretic therapy, diabetic ketoacidosis, hyperosmolar hyperglycemic non-ketotic syndrome, burn. And the correct answer is burns. Here is the hints. A hypotonic fluid has an osmolarity less than that of serum. It has less sodium ion concentration than serum. When this fluid is placed in the vascular compartment, it begins to diluting the serum. And soon, the serum osmolarity of the vascular compartment becomes less than that of the interstitial fluid. Water is pulled from the vascular compartment into the interstitial fluid compartment, and eventually the same process is repeated, pulling water from the interstitial compartment into the cells. Hypotonic solution thus hydrate the cells while depleting the vascular compartment. Number 3. C waves in jugular venous pulse waveform is due to atrial contraction, tricuspid bulging, systolic filling of atrium, atrial relaxation. And the correct answer is tricuspid bulging. And here is the hints. C waves are positive waves produced by bulging of tricuspid valve into right atrium during right ventricular isovolumetric contraction. A wave, atrial contraction. C wave, tricuspid bulging during RV contraction. And V waves are due to systolic filling of right atrium. Number 4. Reversible myocardial stenosis with ECG changes of acute myocardial infarction is seen in restrictive cardiomyopathy, brigade cardiomyopathy, pericardial tamponade, Takotsubo cardiomyopathy. And the answer is Takotsubo cardiomyopathy. And here is the hints. Myocardial stenosis with ECG changes of acute myocardial infarction is typical of Takotsubo cardiomyopathy. Takotsubo cardiomyopathy is a form of reversible cardiomyopathy mimicking acute myocardial infarction in both symptomatology and electrocardiographic finding, but without coronary artery disease on angiography. Number 5. An alternative drug for cardiac arrest in place of epinephrine that has been removed from the AHA-ACLS cardiac arrest algorithm. Amiodarone, atropine, vasopressin, adenosine. And the correct answer is vasopressin. Here is the hints. Epinephrine is the primary drug used in the cardiac arrest algorithm. It is used for its potent vasoconstrictive effect and also for its ability to increase cardiac output. Vasopressin, a single 40-unit dose given MV, has been suggested as an alternative to epinephrine. Number 6. A patient with right ventricular infarction may present with all of the following except nocturia, hepatomegaly, ascites, orthopnea. And the correct answer is orthopnea. Here is the hints. Right ventricular infarct will cause failure of right ventricle resulting in systemic congestion and feature of heart failure. Orthopnea is typically a feature of left heart failure, not right heart failure. Number 7. Pseudopulmonal is typically seen in hypokalemia, hyponatremia, hypocalcemia, hypercalcemia. And the correct answer is hypokalemia. And here is the hints. Pseudopulmonal may be seen in hypokalemia. Pseudopulmonal refers to the presence of tall peaked P wave in absence of right atrial hypertrophy. This pseudopulmonal pattern with P wave peaking may be seen in hypokalemia. And in image we can see P pulmonale in hypokalemia. Number 8. Which of the arrhythmia is most frequently found in holiday heart syndrome? Atrial fibrillation, atrial flutter, atrial fibrillation, ventricular premature depolarization, ventricular tachycardia. And the correct answer is atrial fibrillation. Here is the hints. Holiday heart syndrome refers to the occurrence of acute cardiac rhythm and or conduction disturbances in a person without any clinical evidence of a structural heart disease after a binge of alcohol consumption. The most arrhythmia associated with holiday heart syndrome is atrial fibrillation. Number 9. All of the following are Light's criteria for exudative pleural effusion, except pleural fluid protein to serum protein greater than 0.5, pleural fluid LDH to serum LDH is greater than 0.6, pleural fluid LDH is greater than 233 times the normal upper limit for serum, pleural fluid ADA to serum ADA is lower than 16. And the correct answer is pleural fluid ADA to serum ADA lower than 16. Here is the hints. Ratio of pleural fluid ADA and serum ADA lower than 16 is not a part of Light's criteria. According to Light's criteria, a pleural effusion is most likely to be exudative if at least one of the following exists. The ratio of pleural fluid protein to serum protein is greater than 0.5. The ratio of pleural fluid LDH and serum LDH is greater than 0.6, and pleural fluid LDH is greater than 0.6 or 2 times the normal upper limit for serum. Thanks for watching, and don't forget to subscribe for more videos.